Could the fast food and inactivity of your typical day be the key reason for your poor health today? 70% of all deaths are now attributed to lifestyle choices. And thanks to obesity-related health issues, this will be the first generation to live shorter lives than their parents. We all know the solution: move more and eat better. But we also know the power of bad habits. How do you change an entire lifetime of unhealthy choices? You can't do it alone, but there is help.
Well, I was about 50, a little over 50, and I had been obese for about 30 years and weighed about 80 pounds over my wedding day weight. I just, felt tired all the time, didn't have a lot of motivation for doing much of anything. I knew I needed to lose the weight, and I needed a program that I could do easily and for the rest of my life. When I found out about CHIP, I began to apply the principles that were taught. I began to lose weight. The weight just melted off, and within a short time, I was feeling a whole lot better. I was able to fit back into my wedding dress for my 35th wedding anniversary, something I had always dreamed of and didn't think I'd ever be able to do again. And as I was walking one day, I had so much energy that I just felt like bursting into a run, which I hadn't done for many years. On top of that, I was able to play with my grandson in the park, and I wasn't getting sick anymore like I used to. CHIP just gave me my life back, and it's a lifestyle that I can do for the rest of my life.
Heart disease, cancer, diabetes, and high blood pressure. These diseases, virtually unknown 100 years ago, are now responsible for 3 out of 4 deaths. Today, obesity is the #1 health concern in the Western world. Sadly, our unhealthy lifestyle isn't just affecting adults. Obesity and its lifelong health consequences is now the top concern for children. But what hope is there for children if parents are settling for a life of medications, dialysis, angioplasties, and bypasses?
I first woke up, so to speak, when I was working on the anesthesia service, learning how to put people to sleep. And I was seeing my patients for the next day's surgery for coronary artery bypass surgery in order to bypass clogged arteries in their heart. Because it was late at night, I drew the man's blood test, and when I took the blood to the laboratory and had it processed, I couldn't believe my eyes. Now, normally, this liquid layer floating on top of the blood clot is quite transparent. It's a yellow, but quite clear. You can see right through it. The blood in this patient's tube, however, was anything but clear. The serum floating on his clot was thick and greasy white. It looked like glue. In fact, it stuck to the sides of the blood tube when I shook the tube. I went back to the patient. I said, "Mr. Phillips, did you eat before you came to the hospital tonight?" He said, "Yes." I said, "What did you have?" He said, "I had a cheeseburger and a milkshake." And when he said that, I realized that what I was looking at in his tube was all the fat in the beef burger, all the butter fat in the cheese, and the butter fat in the ice cream and in the milkshake. And all this fat had oozed out into his blood and actually turned his blood fatty. The next morning, we took Mr. Phillips to the operating room, and I put him to sleep, and the surgeon opened up his chest. And from these arteries, he began pulling out yellow, greasy deposits of fatty material called atherosclerosis.
Clearly, our indulgent Western lifestyle isn't working. But how can we change? Did you know that lifestyle diseases aren't just preventable, but also largely reversible? The Complete Health Improvement Program, CHIP for short, is the preeminent community lifestyle intervention education program where participants start to see a dramatic difference in their biometrics after 30 days into their 3-month-long program. Clogged arteries begin to open up, blood pressures come down, diabetes turns around, people eat more but they lose weight, and high cholesterol levels drop often more than 20%.
I thought life was just great. I felt well, and then bang, I got told you've got 6 arteries that are blocked and 99% blocked. And so that was a bit of a surprise. I had to have 5 bypasses after that. After getting over the operation and what had to happen there, I went back onto my normal diet, which I thought was great. I had a good diet, I thought. Went back and had blood tests, and I was surprised. My cholesterol was raised, blood pressure was up, and at that point I was introduced to the CHIP program. I went onto it immediately, straight away. I thought, I have to do this. Within 2 months of going on the CHIP program, all halved. My cholesterol was halved, blood pressure was down. In fact, I had to lower my blood pressure pills because I was getting dizzy. So hey, that was great. And then that's allowed me now to get back into the things I love. 2 weeks ago, I got back on the bike, and one thing I really noticed, when I used to bike before, I was always out of breath. I went out 2 weeks ago, I hit the hills, I didn't even get a sweat. I was doing some marvellous riding, getting back on the bike, biking with my friends, living life to the full. And to me, that my life is just beginning again.
CHIP is all about choices. Safe, simple, deliberate lifestyle choices. CHIP gives you the education, motivation, and support structure needed to make smarter choices. Over 50,000 CHIP graduates are living proof that CHIP works.
In fact, to date, CHIP has over 20 published papers in peer-reviewed academic journals in the medical and scientific literature. And we believe that that makes it one of the most well-published community-based lifestyle interventions in the world. In fact, just recently, the American College of Lifestyle Medicine presented these results and discussed this paper on their website. And this is what they said. This study demonstrates clinical results of a large, we're talking 5,070, free living cohort in North America, yielding some of the most impressive recorded clinical changes ever in the literature.
Medical professionals around the world are taking notice.
The results of the CHIP program are very impressive. I don't know any program like it.
Corporations are bringing CHIP to their workers, reducing medical costs and health insurance premiums, while improving productivity through the reduction of absenteeism and presenteeism.
I'm the General Manager for Sanitarium Australia. I head a $400 million plus sales FMCG company. We have 4 plants here in Australia, and we have a large portfolio of consumer brands which we sell and compete with other multinational competitors in a very fast-moving market, very aggressive market. We have a large range of people from a large range of walks of life that work with us here in operations right through to sales. And to be productive, to be engaged, to be present is really important in our business, and also for people not to be absent, to not be away sick or feeling that they don't want to work. So as a result of my experience, we made this conscious decision to invest in the program. We believe that it would have significant benefits, first and foremost for our staff, because they're the most important thing for us, but secondly for the company. That there would be a huge knock-on effect for us, and that I find quite exciting. And today, I know that over 300 people in our company have enrolled in the program. It's early days, but there's a lot of excitement, there's a lot of enthusiasm around what the program can do for them. CHIP gives me a resilience that I haven't had before. It gives me a physical resilience, it gives me a mental resilience, it gives me this all-rounded approach to life, which I can now engage in my workplace in a much different and more productive way. It keeps me safe. It keeps me a younger man, a more active man. And I felt as I was starting to age, as I was starting to get out of shape, that I was losing that.
CHIP can help you get the healthy life you've dreamed of, kick the old habits of the so-called good life, and help you step confidently into the best life.
I felt that I was living a healthy lifestyle, but I was starting to have a few problems that I attributed to aging. I did not consider myself obese, but I had gained 40 pounds over a period of about 25 years. My cholesterol was raising, my blood pressure was beginning to creep up. I was on medication, a series of medications for lowering my cholesterol, but the condition that affected my lifestyle the most was the osteoarthritis in my knees. I had very limited mobility and limited range of motion, constant pain, and this was affecting the interaction with my grandchildren. When I first began making changes through the CHIP program, pounds began to melt off right away. Inflammation and other symptoms of my osteoarthritis in my knees just disappeared. I was able to eliminate medication that I was taking for cholesterol. I felt so much better, had so much energy, and I truly believe I was healthier than I was in my 40s. CHIP has given me a second chance for an active life and a long life. I'm really looking forward to being an active part of my grandchildren's lives as they grow, and I've chosen to be healthy for the rest of my life.
To find out more about CHIP or to sign up for a program, visit our website on www.chiphealth.com.